Hi. Um, just got back from Turkey. Still going to get used to my speech. It's a bit blah, but I'm sure I will. I've got dentures to put in, but this time I just want to show you what my mouth is without the dentures in. I've had 15 implants fitted into my mouth. I had, I think it was 14 extractions, and then the 15 implants fitted after the extractions. Plus, I had a sinus lift. Because I had not a lot of bone, so they put a bit of the bone into my sinuses. I know this sounds crazy and this video looks awful, my teeth like this, but it's very important for you guys to know about my personal journey. Now, my personal journey from a kid, I had pretty good teeth. I had an accident when I was about 14 years old, which obviously knocked my front teeth out, the first two front teeth, and also the bottom. Which involved some surgery upon my gums, bottom and top. However, they give me a bridge to put over both parts, and pretty much my teeth was normal for many, many years. Until later on in my life, I got an infection in my top gum where I had to have the bridge removed. Unfortunately, at this time, after the bridge was removed, I lost more teeth. So basically, they couldn't fit another bridge. So I ended up with this denture, which I've had for about I'd say about 10 years. Some of my teeth was okay, but and I went along with that for that time, obviously still having fillings from my other teeth. Over time, my teeth started to get worse and worse and worse, and I started to gradually lose teeth at the bottom and the top, where I had more and more teeth added to my denture. And to be honest, dentures are okay for some people if they're happy with it, but me personally, I work in front of cameras, and a personal thing for me was obviously having a mouth that felt good, so I could eat an apple or something like that. A lot of people do it for cosmetic reasons, but I'm doing it because of my teeth has been quite bad, and I'm going through the pain over and over and over again, constant infections. I just couldn't do it anymore, and so I saved up my money and decided I want to go for implants. However, in the UK, implants prices, if you're living in the UK, are quite expensive on a budget. I mean, roughly about 1,500 to £3,000 per implant. And then I looked into see if I could get it cheaper elsewhere, and I come up with some sites that saying 70% off here, but they was actually in Turkey or India or Lithuania, etc. So I decided that I personally would like to go and look into these. So I looked into them all, I researched them all, and I came across this dentist in Turkey called Esnan. So I contacted them, just out of curiosity. I contacted them, and literally straight away, within, I think it was in like 2 hours of me contacting them, I had someone call me, and his name was Hadnan. And what a wonderful, wonderful man he is. He just straight away, I felt like comfortable with him on the phone. I explained my situation to him, and he thoroughly came back with great answers to every question I gave him, which what I needed to hear. He asked me to send a 3D X-ray over to Turkey, sorry, by email, which I did. And within I think it's 24 hours of receiving that X-ray, he was texting me saying, "I've made an appointment to see one of our consultants, and he'll do a video chat with me over Zoom." Absolutely brilliant. And talking to you with my teeth out, because to be honest, I only had this treatment done 7 days ago in Turkey. I'm now back in England, and it is Monday today. I had my treatment last Monday, so yes, 7 days ago. You can see implants. I had 15 implants in total. Anyway, the experience for me with Adnan, brilliant guy, absolutely amazing. He kind of said, "Don't worry, we will make your journey one that's very special and personal to you." And on that note, I couldn't hesitate to say no, personally, in my heart. However, I still hadn't at this point seen the consultant. Based on the X-ray I sent them, with the 3D X-ray I took 6 months prior to leaving UK. the next day, I think I had the appointment. I think it was the next day or the day after. I had an appointment with the consultant via Zoom. Absolutely wonderful man. He had my X-ray up on the screen so I could see it, and also the plan of what, you know, the treatment plan of what they would propose for me based on that X-ray, that 3D X-ray. I think it was at the time, I think it was 28 teeth complete, you know, on my mouth. They wanted to put 28 teeth. Some was crowns, but some was implants based on that X-ray. He gave me a pro forma quote. Adnan did after the consultation, which I was really happy with. And the price, when I looked at it, I actually double looked, to be honest. It was like, and look again. Because how can that be so cheap? Because obviously it goes through your mind, like, dental treatment that cheap when it's 1,500 for one tooth in this country. I think the total plan came to about £6,000, and that's for both visits to Turkey. Obviously I had to book my own hotel personally, which I chose to do, and they provide all the transport. However, I just couldn't. Well, I showed it to my wife, and she said that can't be right. But anyway, we rang back at Adnan and said, "Is this right?" He said, "Yeah, that's right, based on your X-ray." So I said, "I'm coming." So with that, I booked my flight. I got medical insurance, which I do recommend you guys get. And there's a company on the internet, if you type in dental medical insurance for travel, do get that. Whether you use it or not, it doesn't matter. Obviously, it keeps you that little bit of extra cover if something does go wrong or you have to travel back. So I got that. I sorted all my flight details. As I say, I flew out last week. Very apprehensive, very nervous, because not knowing what to do in a foreign country. But having Adnan by my side, an English interpreter who spoke fluent Turkish, was absolutely a bonus. So I flew out, and my journey, when I got out there, I was picked up from the airport. I was taken to my hotel, which I chose. Beautiful hotel, very clean, very friendly. The food was great. I wouldn't want better, to be honest. I had a sauna and steam room and swimming pool. It was just lovely. Anyway, the next day on the Monday, I'd obviously got some sleep, and the next day on the Monday, I actually went. He said he'd pick me up at a certain time. I was ready, out the door, and it was there. The taxi was there, and the driver, who took me down to Esnan Clinic, where I was greeted again like royalty. They even opened the door to the taxi for me and welcomed me in the door. As soon as I got into the dentist, it was like everything. You could actually see your face in the floor. It was spotless. It was something like, I would say, you'd walk into a dentist who never experienced that in the UK. It was just so clean, absolutely clean and spotless. And in fact, the cleaning lady was constantly going around cleaning and mopping down, polishing the windows, whatever they need to do in there. But it was just. But Adnan was there, who greeted me with a massive smile. I was then took to reception, who obviously to book me in for my treatment. I waited, I think it was about 20 minutes for the consultant to actually get me ready and take another X-ray. At that point, I had to have another 3D X-ray, which I think is important because as you said, my X-ray I did send out, a 3D X-ray, was 6 months old. With that, I come in a fancy dressing gown. I thought I'd do this when I got up this morning, so it's just I'm still literally out of bed. So I wanted to do this for you to see me as I am without my teeth. Anyway, I had my 3D X-ray, and after about 20 minutes of waiting, after that I came back, sat down for a minute, and I was called into the consultation room, and they had my X-ray up on the screen. I was greeted by another consultant there. By the way, I have got a Google review. If you go onto Esnan Dental Clinic, Turkey, look at the reviews. I've actually put one out there, so you'll get to know the doctors and people who dealt with me. Anyway, I sat down in a chair, and the X-ray was on the screen. Adnan was by my side, so he was interpreting everything the Turkish doctor, the consultant, was telling me. At that time, my plan had changed. you know, obviously my x-ray, my teeth had obviously deteriorated a bit more over the 6 months. So my plan was a bit changed. And at that point, I had two options. Two options. I could still keep some of the teeth and have crowns on them, or have all of my teeth pulled out and have total full mouth implants. Obviously, there was two different costs involved in that, and one was a lot cheaper actually than on my first pro forma quote. However, he explained to me clearly that if I was to have that first one, the possibility that I'd have to have come and have, because my teeth was white, he said possibly over a period of time you'd have some of the crowns fall out again, and it would be back to square one. The second option was a more of a permanent thing, which is a guarantee, pretty much their lifetime guarantee, what they give you. Well, just have all the teeth taken out and implants put in. That was a little bit more. I think I ended up paying £1,000 more than my original quote, which to me is a no-brainer. And after that, I used to give me an option, and as I said, I took the second option because obviously I want to not have to keep coming back again and again and again. I want my teeth to last. So I think that second option was the best for me personally. Your own journey would be your choice, or you might still have teeth that are healthy teeth that you just want crowns put on, and again they do that, and obviously it's all different prices for that. So I chose to have option 2, and with that I waited, I think it was about another 30 minutes, where I was then given a tablet which I suppose helps you to relax. They gave me that, and then I had an injection at my buttock. Ow! Which was quite bruisey, but you know, it was supposed to be an injection that helps you calm down and helps to relieve the swelling over, and it stays in your system. I think it's for about 2 or 3 days after the surgery, and I think it's also to stop shock. You know, suddenly if you have all your teeth pulled out, and you know, and then you can't feel it while you're having all the anaesthetic in your mouth, but as soon as you kind of like come around here, oh, I've got no teeth, and the swelling stops, so it's a bit of a shock to the system. So I think it helps with that too. So it was great. Anyway, that was my journey there. I was taken into the surgery it was pretty quick. I think I was in the chair for about 2 hours, just over 2 hours. I didn't understand anything they was talking. There's lots of talk going on around me. However, I had my eyes closed all the way through the procedure. In fact, I had my eyes closed with my mouth open. They numbed all my mouth. Plenty injections. They give you plenty to obviously stop any nerves. Literally, my face I felt like fat out here. I didn't feel nothing. Anyway, they started the treatment, and it just open the mouth. They someone open my mouth. There's constant someone there, literally around me all the time. So I felt comfortable in myself. You know, I felt relaxed. And did I feel any pain while I was doing taking my teeth out? Tugging, which if you go to any dentist, your teeth pulled out, you'll feel tugging. But there was no pain with that tugging. It's just you feel tugging. Did I feel any pain while they was putting the implants in? Not one, not a bit. In fact, I just sat there and relaxed. It was just like chilling for the 2 hours in the chair. It was quite relaxing, just listening to them chat and just telling me to open my mouth, and obviously someone in there sucking anything that's coming out. So the whole experience was pretty good. Anyway, I came out of there straight away. They gave me 2 like ice pack things to put on my mouth, on the side of my mouth, to stop the swelling, which I did straight away. Pretty much do that, and I do recommend you do that. I think you want to anyway. Anyway, I got back afterwards. They, you know, it was nice to me. They took me back to my hotel, explained everything to me, what I can eat and what I can't do with them, etc., etc., etc. Went back to the hotel, and it felt strange not having no teeth, because I see you can't bite on no more, and it feel strange. When the anaesthetic started to wear off, obviously they give me a prescription out there. They give you a prescription which you take to the chemist for antibiotics and painkillers or mouthwash, which you can just get at the chemist. You get a prescription. It doesn't cost much, to be honest. Leo over there is quite good. So I got all those, done everything I was told to do. I do recommend you do as you're told to do, because like me, you know, I did actually put my teeth, you know, when I came out, I actually got my teeth. I finally put them in and wore them for a little while, and ended up with sore gums, which would happen anyway. but you don't want that. Do everything, don't do like I did, do everything they say. Um, as far as food goes, you think, oh, I can't eat food no more, can't munch food. But you know, they say eat soft foods for 2 weeks. I think it's about 2 weeks. I'm sure there's kind of loads of foods out that you could still enjoy, but you know, eat soft foods. Don't go eating like burgers or steaks or crisps or chocolate bars. It's not going to work. So don't waste your money doing that. I know your mind would say, "Oh, I want a McDonald's. Oh, I miss this." Don't. Just keep eating your soft foods, soups. You know, things that you can, you know, still get your vitamins. Protein drinks is good. You know, in this country we've got Complans. I think it's Complans a pretty good thing to take if you're not getting the proper nourishment and vitamins. So there's lots of different things. Anyway, goodbye. That was pretty much my journey, and obviously the pain over the next few days was obviously controlled by the over-the-counter medications like ibuprofen and that. So there you go. I think it was on the third day I went back, and I had then impressions taken of my bottom jaw and my top jaw. The top jaw, and that the lady was brilliant. I went to see someone else. She put to do all the impressions. They were sent away, and I came back. I think it was the next day after that. My teeth was ready. My dentures, I have got them, and I can show you them now. They was ready. However, not completely ready. They was just ready for my first test of them. I'm going to put the phone down here so you can still see me in my sexy dressing gown. Hey. But they are, if I get my teethies out, these are the dentures they give you. Remember, these are only temporary for 5 months. And these are, get them together. Look at them. I mean, you can see them, guys. That is my teeth, and they're in my mouth. So that is it. So I'm going to pop one of them in now, just to show you guys. Brilliant. See? I'll put the ball in. I still got to put in there. There you go. Take them out. As I say, this is about my gummy. I want this video to be done based on that. So yeah, you go back for the first fitting of your dentures. You put them in and they adjust them, basically, because obviously you're feeling a bit uncomfortable, your gums or hurting, pressing against it. They'll adjust them until you're happy, basically until you're happy. Then you'll be released from the dentist with your dentist. I think it's the next day. They'll come and collect them. You put them in. They do the adjustments again until you're happy. If you're happy and you go away, and they say to wear them for a couple of hours, and you still feel a bit sore or something, don't hesitate to phone your rep up and ask them to have another assessment before your flight back home. I recommend you do that, and they will come and pick you up from the hotel and take you back and do them again until you're happy, which they did for me personally. Because when you're wearing them for 2 hours after, you have to imagine like it's the first time you've been away from the dentist with your new dentures, and he's told you to wear them for perhaps an hour or so throughout the day to get used to them. And that gives you a bit of time with your gums of what parts are hurting because they're moving around. You can get that Fixodent stuff you put in, you know, the creamy stuff you put on the teeth, which I would recommend to keep them stuck in. But don't do that to begin with, because you want your mouth to adjust around them. Your mouth's going to be a bit alienated to them when they're first going. It's going to say, what the heck are these? Things that you just shoved in my mouth. But it does get used to it, you know, there's your brain receptors and all that will get used to it, and they'll adapt perfectly to how you want them. So yeah, would I recommend, would you ask me personally if you're thinking about having dental implant surgery abroad? As long as you're covered with your insurance, as long as you've got a great interpreter out there and your plan is made perfect before you travel, I would say a definite yes. You know, because our smile is so important. It's the first thing people see, and also, you know, people who have got, you know, constant infections and constant battles with their teeth and the cost is just going up year in, year out as visiting the dentist, then I would definitely recommend going. With the implants, they will be fixed teeth for me personally when I actually get them in 5 months' time, which is a time to the implants to actually settle in your mouth and the bone to grow around the implants, which makes them strong for when you have your actual initial implants placed onto the teeth. Now you get for a full implant, you get 15 implants, bottom and top, total. Now you say, well, there's 28 teeth in the mouth. How does that work out? Well, what they do is, as you can see, they spread the implants out. So a tooth will be attached to that implant, and I think it's another crown. A crown will be attached to that, and a crown next attached to that implant, and so forth. So it's a bit like a little bridges all the way around your mouth, which will make up the 28 teeth. I've chose zirconium crowns, which I would say, if you are going to get dental implants, do go for the zirconium crowns opposed to the porcelain. There's a bit of a difference in them, I think, for quality and you know, obviously the length of time they last in your mouth, and obviously the colouring, something to do with the sun when it's hitting the dental implant. All in all, folks, me and my sexy dressing gown, if you are thinking about it, contact Esnan today and go and make that journey. You won't regret it. Total cost for me, for my whole of my treatment, for all of the 15 implants, for the sinus lift, for the temporary dentures, which I have to wear for 5 months, and my journey back, I would say it's cost me a total of £8,000. Now isn't that worth it? That's for my treatment, which is a full. Yours could be even cheaper. Don't hesitate. One implant in this country, as I said, 1,500 to 3,000. I've had 15. Work it out for yourself. Anyway, good day, and I'll speak to you guys soon. Bye.